What are some comfort measures that people can always be thinking about too?
Yes.
When things start hurting.
Yeah. TENS units, I don't know who came up with the idea to try to use it for labor, but whoever did is a genius because it is amazing. I love the combs, the birth combs. And again, it's that same kind of idea of distracting your brain and causing pain in a different location so that you almost focus on that and it takes the pain away from the contraction that you're feeling.
Motherhood is all-consuming.
Having babies, nursing, feeling the fear of loving someone that much.
And there's this baby on your chest and boom, your entire life has changed.
It's a privilege of being your child's safest space and watching your heart walk around outside of your body.
The truth is, I can be having the best time being a mum 1 minute, and then the next I'm questioning all my life choices.
I'm Lo Mansfield, your host of the Lo and Behold podcast. Mama of 4 littles, former labor and postpartum RN, CLC, and your new best friend in the messy middle space of all the choices you are making in pregnancy, birth, and motherhood. If there is one thing I know after years of delivering babies at the bedside and then having and now raising those 4 of my own, it is that there is no such thing as a best way to do any of this. And we're leaning into that truth here. With a mix of real life and what the textbook says, expert insights, and practical applications, each week we're making our way towards stories that we participate in, stories that we are honest about, and stories that are ours. This is the Lo and Behold podcast. Welcome back to the Lo and Behold podcast. I kind of don't even want to tell you who I have as a guest because then you might know right away. And I want to keep you in suspense, but you're probably going to be familiar with her as soon as she introduces herself because she is online. And if she's in your feed, I think that that's a really good thing. So I will wait. I will let her introduce herself to you. I do want to mention that in the combo today, we do get into the topic of disordered eating and then also how that could relate to pregnancy and postpartum. And so if that is something that you just don't feel like taking in today, go ahead and skip that. It is at the end of the combo, so you can kind of listen in if you want until we get to that point, and then you could jump out if that feels like something that you need to do. I have another great guest for you guys today. I'm just going to let her introduce herself right away because if I tell you who she is, then you'll probably know who she is by her name. So why don't you go ahead and introduce yourself to us?
Hello, everyone. My name is Sydney, also known as Nurse Sydney on social media. I am so excited to be here today. I am a labor and delivery nurse and online birth educator in the birth postpartum world online, but I've also been a labor and delivery nurse we're going on 6 years now, which is crazy. I know it's not that much experience, but to me, I still feel like I just graduated. So it's crazy.
So I always think it's really cool when people share. I've had 20 years of labor and delivery experience, but I also think that depends on like the type of unit you work in. Obviously, all the experience is valuable, so I'm not trying to belittle or lift up anyone's, but like some units deliver 60 babies a year and other deliver 2,000 a year, right? And so even just saying like, I've been working for 6 years. Well, for some people that might mean 600 babies. And for someone else that might mean 120 babies. So I think obviously anyone can speak into this space, but the idea of how long it's been or whatever, it's also, I think it's just always cool to think about how many births and experiences that actually might mean for someone too.
Yeah. And I was lucky enough to start off right in this space. So like I graduated nursing school and I knew I wanted to work in women's health. So I went straight to postpartum and then labor and delivery. So I'm kind of unique in that way because I feel like a lot of nurses start off on other units and then they transition into labor and delivery or a more specialized unit. But I can like fully say I've had like a solid 6 years of experience with labor and delivery specifically because I just loved it. So I was like, I'm not doing anything else. And I also worked at like a large downtown hospital in Toronto. So we had a lot of births. So I definitely got a lot of hands-on experience, which was great.
Yeah. Just in case some of you aren't familiar, Cindy recently moved from Canada to the US too. So soon she'll be able to kind of maybe talk about some of those differences too, which would be cool.
Totally. That's my plan. I'm still kind of looking for a job, figuring out all the certifications that I need here and just getting my California license, which if anyone is a nurse and has worked in California, it's a little bit hard to get a license here. So I've been dealing with all of that, which has taken some time, but the hope is to be able to be back at the bedside, hopefully later this year, because I love labor and delivery nursing. And I can't wait to see the differences between the US and Canada. And I actually am lucky enough to still have my position back home in Canada too. So I obviously don't work full time, but anytime I go back, I can pick up a shift there, which is amazing. So I'm literally going to be able to work in Canada and the US at the same time, which is really a really
crazy.
Special experience. Yeah. Yeah.
It makes me think of, this is me coming straight from television, but how like doctors can pop in and have privileges somewhere. It makes me think of that idea. Like here in the US, sometimes you would want to ask your physician, like what hospital they might have privileges and make sure that lines up if you want your certain OB in a certain hospital. Because typically if you're a nurse, you can float obviously and travel, but I've never heard of it across country lines, like being able to pop into either. So that is very cool.
I know. When my manager, because I told her, I was like, I would love to keep my position if that's at all a possibility. Because we might end up moving back to Canada at some point. My husband and I aren't really sure how long we'll be here. So I was like, if I can keep, my name in the system and be able to still work there, I would love it. And she was like, absolutely. So yeah, I'm really, really fortunate for that. I'm really grateful.
Perfect. Okay. So really quickly, I just want to hear how you ended up online sharing all of this stuff too. And then we can get into other stuff.
Totally. So I started posting on TikTok. I think most people started on TikTok. And this was in 2022, I believe I started. So I was still kind of like a fresh nurse because I graduated in 2020. So I had 2 years under my belt. And on my days off, I was just scrolling TikTok as everyone does. And I kept coming across videos of people posting what to pack in your hospital bag before you go in for birth. And I was like looking at them and I was like, you know what? I know what you need to pack in your hospital bag. Like I've seen everything that people have packed, whether it's like way too much or not enough. And so I just decided to post a video one day. And it was, honestly, it's a terrible video. It was just, I just did a voiceover with like screenshots from the internet of things that you need to pack. I look back on it and I'm like, this is so funny. But I mean, it had all the information that it needed in it. It just wasn't the most aesthetically pleasing video, and I posted that and honestly, it went pretty viral right off the bat. So I just continued posting after that and it kind of blossomed into education on birth and postpartum and any questions I would get online. I just started making videos and yeah, here we are like 3-4 years later and I'm still doing it. And I absolutely love it. It's so fun. It's nice to be able to reach such a larger audience because I feel like the information I share on my accounts, it's education that I give to my patients in the hospital, right? And now I'm able to amplify that on such a larger scale, which I think is so special.
It really is interesting because so many of specifically like the TikToks that you do so often where you're just answering a question, like that really is what it's like to be in birth or be postpartum and chat with your nurse, right? Like the number of times we're in there just like chatting while we're charting and answering a question. It really is just those simple things, but you don't know it until you walk through it. And then, ideally you get a nurse who is that invested in chatting with you and educating you. So I just think it's so interesting how obviously the hospital packing list, these really intentional thought out videos can be really valuable. But so often I just love those like answering a question ones where it's like, hey, if you and I were grabbing coffee and we were just chatting and you asked me any random thing, this is what I would tell you. And I think it resonates, obviously, which is why, you've grown or other providers like yourself who are doing that is like people just want to ask the simple question and just get like a chill, let me tell you, type of answer.
Kind of without that fear. And I feel like there's so much online that can be scary or people saying, I had this terrible birth experience and this is what happened. And I mean, I'm all for people sharing that experience. I think it's important to shed awareness on that. But for someone who's going through it for the first time, that can be really daunting and really scary sometimes. So I like to be that person that people can come to get their information and feel more prepared so that when they go into their birth and their postpartum experience, they feel a little bit more prepared and a little bit less scared of what's to come, if that makes sense.
Yeah, that's perfect. I mean, I feel exactly the same way. So that idea of like decreasing fear by just giving information and letting you then do what you need to do with it. Like that's just the goal, right?
Exactly. Right. I always say, and I'm sure you're very similar, but like, I am a nurse. I'm not your nurse, but I'm here to give you information and tools that you can use and bring to your providers to be able to advocate for yourself and hopefully have the birth experience that you want and that fits right for you.
Yeah, exactly. All right. So that's a good segue into what I wanted to do with you today, which I mentioned to you before we started. This is kind of like trending a little bit on social media lately, but this idea of like ranking things in birth, right? Like ranking the level of pain or ranking your favorite postpartum tools or whatever. So I wanted to use that idea a little bit with you to kind of walk through some of the pain tools that your patients have available to them. And I was thinking too, when you were saying from Canada, hope to practice here in the US, my brain kind of went, but what's cool is that there is so much that is still really similar, which is why we can educate across obviously state lines and country lines. You know, I got to live in the Netherlands for a couple of years, 2 years ago.
Oh,
and
I
even
didn't know
like
that. That's
having,
amazing.
we could talk about that some other time because I could talk about that forever.
That's so cool.
But their healthcare system is really different. I was pregnant while we were there, so I got to experience it in this OB space. But also there's so much that's the same too. So I think that that's really nice when we educate is you can clarify, hey, I practice in the US or I practice in Canada, just so you know. But
100%.
the rest of this is probably going to be relevant. So with that in mind, I want to go through kind of the clinical pain tools that people have available for them. And we can kind of chat about how we would rank them, how we think about them as a nurse. And then I can chat about what I've utilized in my own births too. But before we get into those, again, air quoting like clinical stuff, will you just chat about kind of comfort measures? Because I kind of look at them as like we have all these comfort measures that are things you can be doing at home and things you can be doing in the midst of everything else. And then we also have the clinical, like an epidural type thing. So what are some comfort measures that people can always be thinking about too?
Yes.
When things start hurting.
Yeah, 100%. And I love talking about comfort measures because I think it's often forgotten too, but can be so valuable, right? So I usually say to all of my patients on my, hospital bag videos that I've talked about before, to always bring something from home that gives you comfort. So baseline comfort item would be anything that makes you feel like you're at home. And I always joke, I'm like, if you have like a favorite stuffed animal or a blankie or something that makes you feel like you're safe, bring it. Like no judgment. I've had so many patients bring like a stuffed animal that they've had for years. And I'm totally for it. I'm like, that you don't need to be a child to bring that to the hospital. The hospital is a scary place. Bring it. If it makes you feel more comfortable, bring it. So even if that's like your favorite fuzzy blanket, your favorite pair of fuzzy socks, anything like your own pillow from home, if you want to bring it, anything that brings you that comfort and makes you feel like you're more at home. I've seen some people also bring like LED lights or twinkly lights that they can hang around the room. I personally love that. We have some at the hospital that I can sometimes hang up for my patients, but it's always great if you bring your own because we don't have that many at the hospital. But
I'm going to interrupt you. Isn't it so like when you walk into those rooms, it feels so like, doesn't it like hollowed ground? Like, I don't know how to describe it. Where you're like, hey, how you guys doing in here? I'm whispering intentionally, but it's just like,
it's
everything.
zen.
It just feels so, it feels so zen in there.
Yes, which I love. And it's, creating that environment that's going to relax your body. And I feel like I'm a strong believer that you need to feel safe in order to birth, right? In order to birth well. And if your environment reflects that, then it'll happen more easily for you. So little LED candle lights, if you want to bring those, because most hospitals don't allow real candles, but that kind of environment, dimming the lights is going to be amazing. And then going with that also is music or any kind of auditory stuff. So if you have headphones, if you want to bring your headphones and kind of go into your own birthy world, I love that. I love when my patients do that. You can also bring a little portable speaker if you prefer that over the headphones. But kind of like think about all of your senses. So you've got, the lighting in the room, you've got the music, so your auditory senses, and then like smell. So if you want to bring any like I love the peppermint halo. Have you guys, I think this is a Canadian thing actually, but Sage, have you heard of Sage? I think it's a Canadian brand, but they basically sell like essential oils and stuff like that. And they have one that's called a peppermint halo, and it's basically just peppermint oil, but it smells so good. So you can literally just like smell the peppermint oil. And then, using another comfort measure I love is warm water. So not all hospitals have tubs in every room, but even if they don't have a tub, you can still get in the shower. Use the warm water of the shower. It is going to help you tremendously. You have no idea. It's the best.
I think one of the things for water too that just popped in my head, because a lot of people don't have tubs, and a lot of people make you get out of the tub to deliver. So you can, like here in the US a lot, you can labor, like water labor, but you cannot water birth. And so just that idea of like, oh, I have to get out, or they make you get out or whatever. But the shower can be nice. We would a lot of times put a birth ball in the shower because it was, a stall. You're basically walled in. And so then you could still sit and relax and maybe turn around and it's on your back or something. And so just knowing that you can also like do creative things with hydrotherapy in the shower if a tub's not available to you, or they make you get out or whatever. Like monitors can go in there if they need to. IVs can get wet, or they can get wrapped up a little bit, like just exercising those possibilities when it comes to water.
Yeah. I think a lot of people don't know that they can even go into water if they have an IV, or if they're, on continuous fetal monitoring because they're on oxytocin or something. But the amount of patients I've popped in the shower with all of that stuff, like it's totally possible. Yes, it's a little bit more work on our end, but I am all for getting you in the shower or tub to make you feel better. And it can be a really valuable tool.
It's perfect. Okay. So comfort measures, like we said, it's kind of like those things that you can think about no matter what else is going on, right? Like you could always listen to music, even if you had an epidural. You can't always get in the shower, but you could get in the shower when you have other things going on. I think like even breath work could fall into that, right? Like you can always figure out how to be in charge of your breath, of your breathing. Music, smell. So the one thing when we jump into this next part of the combo, I think for all of you guys listening, is this idea of like, keep all of those tools, and a lot of them can be combined while we talk about maybe utilizing some of this other stuff. So it's like, I feel like it's like a lot of puzzle pieces. Typically, you're not like, all I did was listen to music and it got me through. Like most people are doing 3 things, 4 things, 6 things.
A few things.
And all of that put together is what gets them to baby.
Distraction is key. Like that's a lot of those aspects, like listening to music and like having the aromatherapy or the hot water, or even just like a hot water bottle or heating pad. It's kind of distracts your brain. So I think that in conjunction with other pain management options can be really, really key in labor.
All right, Sydney, that's perfect. The distraction idea, that's perfect segue into, let's talk about one of these first tools, which is the TENS unit. So why don't you just kind of like explain what it is really quickly, and then share your thoughts on effectiveness.
So TENS units, I mean, they're used for a lot of muscle rehabilitation. So they're not just used for labor, but I don't know who came up with the idea to try to use it for labor, but whoever did is a genius because it is amazing. So you put it on your back, on your lower back, and it basically kind of like pulsates, and it just makes a strong, like pulsating. I can't even describe it really, but it's like a not pinchy feeling, but it just gives a little bit of almost like the counter pressure technique as well that you can use, but it does that on its own, and it distracts your brain from the contractions that you're feeling in your lower back or lower belly. And some people love it. Like some people think it's the best thing in the entire world, and they want to use it the entire labor. Other people don't really like it. But I always say it's a good thing to try, especially in early labor, or if you're having back labor. I think it can be really effective.
Did you guys stock them at your hospital in Canada? Because they're not typically stocked in the US. It's something you have to own and bring in if you want to have it, like once you head into your hospital.
Exactly. Yeah. We had some midwives that would work in the hospital, and they had their own that they would bring. So sometimes we'd borrow theirs if they weren't using it. But yeah, I wish it needs to be something that's stocked in every room, but unfortunately it's not. I always say if I could make my own labor ward, it would definitely have a TENS machine in every single room. There would be so many things I would do differently, but yeah.
No, definitely. I think it's good for you guys to hear that. And it also might be, Sydney mentioned it's great for early labor, which I would agree. That's probably what a lot of people find it we'll say most helpful, or really, really, kind of cutting back on what they're experiencing otherwise. So it is nice. You can get them like $25 on Amazon here, and
totally.
you could have it, for those 8 hours at home before you head in. And it could be pretty great.
I do know in Canada too, depending on like what insurance company you have, sometimes they can cover some of the TENS unit. So
I'm sure that's true here too. Yep.
Yeah.
Like a FSA, HSA, like our extra spending accounts. Yeah. Yeah.
Exactly.
Okay. So the big question, 0 to 10, 10 being the thing that's most effective, or that your patients really seem like it's working. What number would you give this in terms of how it helps?
Probably like a 4 out of 10.
That's what I was going to say too.
Yeah.
I give it a 4.
Yeah.
But I guess we should caveat that with this is so personal with everything we're going to chat about. And some people are like, 100%. That's it. I just used that TENS unit and it got me through, and other people are like, yeah, right, that didn't do jack. But
everyone's
in general,
different. Every labor is different. Every baby is different. Exactly.
Hey friend, quick pause for just a second. If you are listening to this podcast because you want to feel more prepared, more confident, and less freaked out about birth, that is exactly why I created the Your Body, Your Birth course. This birth course will not tell you what kind of birth you should want, and nobody has the right to do that. It is about helping you understand what's happening in your body, what your options actually are, and how to walk into your birth feeling grounded, excited, ready, instead of overwhelmed and scared. When you have education like this, everything changes. Your mindset, your conversations with your care team, and the birth experience itself. No more relying on random opinions, okay? Stop scrolling. Take intentional action with me and start trusting your body, your voice, and your decisions today. Head over to www.thelabormama.com/birth, also linked in your show notes. And be sure to use the code podcast at checkout to save 20% and start working towards this better birth for you right now. Okay, let's get you back to the episode. Okay, so let's talk about the spiky balls and the combs and kind of that, because it kind of goes along with this distraction combo. So what's that about?
Yes. Honestly, I love the combs, the birth combs. So it's basically like a hair comb, like people literally can use a hair comb. And it basically puts different pressure points on your palm and you hold it and you can squeeze it during a contraction. You can put one in each hand, which I love. I love when people have two because they can hold on to one in each hand. Or if you have one of those spiky balls, you can use that as well. And again, it's that same kind of idea of distracting your brain and causing pain in a different location so that you almost focus on that and it takes the pain away from the contraction that you're feeling. And honestly, people love this one. And it's an easy thing that you can just throw in your bag, bring to the hospital with you and use during your contractions. And I've had people like sit on a birthing ball and just squeeze the birth combs while they're having the contraction on the birth ball. And it is amazing. They love it so much. So really effective, and underrated in my opinion.
Yeah, I think it's kind of underrated too. I think both this and the TENS unit, if you're the one kind of playing with it, both of them give you the chance to control something, to think about something else. And I feel like that mental distraction is really valuable because there's this physical thing going on where your body's experiencing two things. And so we can mess with that. But your also brain is like, all right, I'm going to turn it up right now. I'm going to squeeze. All right, then I'll let go. And I feel like that helps our brains too, of have something else to focus on instead of oh shit, this hurts, like that type of vibe that can help get us out of that a little bit sometimes.
Exactly. And I think I'd give this one a similar rating to the TENS unit, maybe like a 3.5 to a 4. Somewhere around there, maybe a little bit lower than the TENS machine, but in and around the same area for sure.
And remember, you could also use them together. So, what happens if you put them together with the music? See how this all goes together?
Yes, they all add up and help all together. Exactly.
All right. So that's great because that's also kind of this idea of stuff at home that you could have before and bring to the hospital. We stocked cheap hygiene plastic combs on our unit, but not an actual comb. So if you're like, I like this idea, you're probably going to want to buy an actual labor product.
And again, on Amazon, they have them there. I like the wooden ones. I think those ones work really well. and they're comfortable to hold for long periods of time. So yeah.
Yeah. So those things, something you can incorporate often in early labor or before you have to go in, and then you can bring them with you as well. So that's what I would put a pin in about those two. All right. So let's go to sterile water injections next.
Yes. Sterile water injections. I actually love these. Fun fact, had my colleagues do sterile water injections on me. And
I was just going to ask
pregnant.
you. I know, but you can do it to anyone technically.
You could totally do it to anyone.
Yep.
Yeah. And we were trying, like we were just practicing so that we would know how to do it with our patients. And I was like, yeah, I'd love to do it. I have a video on it. We filmed it so that you guys could see it, but it actually hurts. It's like, I'm assuming that when you're laboring, it's nothing compared to the pain of the contractions, but because I was completely, not laboring and I wasn't in any pain, then I felt that, and it was pinchy. But it's basically, like you said, it's like a sterile water that we inject into your lower back into 4 different points. And we just use very small needles. They're just insulin syringes or the needles that we would use to give baby like a vitamin K injection or any. So they're really, really tiny. And it's a subcutaneous injection, which means it just goes underneath the skin. So it's very similar to, if anyone has ever had a TB test done, it's very similar to that. So it creates like a little bit of a bubble underneath your skin of the sterile water. And it feels almost like a little bit of a bee sting. I would say less than a bee sting, like not as intense as a bee sting, but it gives you that pressure and that pain in that location. And sterile water injections, I only use them for patients who are having back labor. I don't find that they're effective for patients who are not having back labor. But if you are having back labor, it can be night and day, truly night and day. I've had a lot of patients who swear by them, and it has gotten them through their labor.
I think it's good to know too that they can be like repeated. It's not quite like, putting a medicine in your body or getting, IV pain meds, which we'll get to. This is like, you can go ahead and do it again. And it's not like they would just keep shooting this in you every 5 minutes. Like that might mean it's not really working that well. But this idea of that if you're loving it, 45 minutes later, you're like, let's do it again. Like that is something that can be repeated for you.
Exactly. And usually because there's 4 pressure points that we do it on in your lower back, I usually get another nurse to come and do it with me so that you're only getting a couple at it. Like, sorry, I'm not describing this.
Well, I know what you're describing. I know what you're
I'm
trying to say.
Think of someone who hasn't seen this be done.
Essentially, it's just, we're trying to get them in like as quickly and efficiently as possible. Right. So it's not like one by one by one by one.
Exactly. I can only think of like a piercing, like, when you would get your ears pierced as a kid and 2 people would do it at the same time. It's the same kind of thing. So usually if there's another person available, we'll do it that way. And I've repeated it like 4 times with someone in labor and like once every hour or 2, and they love it. So super effective.
Okay. Rank it for us.
I would give that one probably like a 5 or a 6.
Mm-hmm. And I would, again, I know we keep caveating like that one being subjective, because I have had patients who are like, that stung so bad that is not worth like anything it could do for me. So there's like, if you get over that hump or if that's not your experience, then it could be pretty effective. But some people are like, no, I'm not interested in that. You get the first one in and they're like, you may not, like you're not doing it anymore. So it's interesting.
It's true. And I think it depends where you are in your labor, right? So if you're too early and you do it too early, it might actually just hurt more than it benefits you. But if you're in a good active phase of labor, I think that's when it's the most effective.
Well, and like you said, if you're having back labor, that can be so all consuming, which is essentially just feeling contractions in your back, just in case you're not familiar with what that means. So instead of feeling them like under like lower stomach, lower uterus, you're more feeling it in your lower back or both.
Exactly.
But I think when you're having back labor, that can be such an intense experience that, you're saying, if you're farther along, having that sting is like the juice is worth the squeeze type thing, because what you're experiencing otherwise is not your favorite thing at the moment.
Yeah, exactly.
All right. I just mentioned the IV pain medication briefly. So let's talk about that one next.
Yeah. So it's usually used in more earlier labor. Again, this varies a little bit depending on your hospital policies. Like one hospital I worked at, they only allowed me to do it in early labor. And then another hospital I worked at, they allowed it to be a little bit later. But basically the thought process behind that is if you give it too close to delivery, sometimes baby can have a little bit of those effects and come out a little sleepier. So they like to give it a little bit further away from when they think you're going to actually deliver baby. But that being said, it can be very effective. It can really help, especially if you're in that early prodromal labor for like hours and hours and hours and you haven't slept and you're just needing to rest. I find that it works really well at that time when your body is just so exhausted. You've been going at it for hours. You're not making much progress, and it just allows you to rest and relax. And usually that's sometimes what you need to kind of kick you into that next level of labor. So I really like it. I think it's super effective, especially with first-time mamas who've been in that prodromal labor for a while. I know my friend, I think you had her on the podcast, Labor Junkie RN, she used IV pain meds throughout her labors and she loved it. She said it was so, so helpful. So again, a really great option if you're comfortable with using it. It is a safe option as well. And if, I mentioned giving it too close to delivery, if for some reason that does happen, we have the tools that we need in case, if we have anything to worry about with baby, there's pediatricians and all that on call in case anything happens. But majority of the time, I would say baby comes out totally fine. So it's not an issue there. And it really, really works well for pain.
I appreciate you saying like, hey, this is a safe option. Because I think sometimes people think, wait, what? It's going to the baby. Like, what are you talking about? And that's fine if that's like, no, thanks. Like, I'm not interested in that because I don't want anything to go to baby. That's totally fine. But I think just understanding, that's why, we give it within a certain time frame. And obviously labor is unpredictable. You might have your baby 5 minutes later and we weren't expecting that. But like in general, these policies around it are there to just, prevent what you were talking about. But it is okay. It's something that you can consider, and it's not like you're, why are you choosing yourself over your baby or something like that? I don't want you guys to think that with this. Yeah.
No, not at all. And again, that's why it's a super personalized decision. And it's a conversation you can have with your care team because they can walk you through exactly what's going on with you at that moment and whether or not IV pain medication would be a good option versus something like the epidural, for example, because I think there's different reasons and timings as to when we would choose certain pain management options versus others, if that makes sense. But it's hard to kind of generalize that to everyone because again, I'm not with you during your labor. I don't know exactly what's happening to you in your particular situation, but I would say for this one, I find it works the best in early labor when you've been having that early prodromal labor and you're exhausted. You haven't slept for like 24 hours and you need to rest. It really allows your body to rest and gives you, time to just relax so that you can continue your labor in an effective manner.
Okay. Number. You have to give me a number when you rank it.
It's hard. I probably give this one a 6.
Okay. I would agree with that. Yeah.
Yeah.
Not
you
like
would
dead.
too?
Yeah. I didn't end up utilizing it with my kids, but I think, and you can tell me this too, actually, I felt like the first dose was often really helpful. Sometimes the subsequent, if they got a second or third, I would often teach like, sometimes it's a little less effective. Plus maybe you're progressing. And so that combo of your progress and like repeated doses starts to feel less valuable. But that the first one often was like, oh, finally, like some relief. And maybe you're going to nap and then maybe you're able to get back out of bed when you feel a little better and keep moving for a little while. So that first dose, especially if you got it early enough, again, like you're saying, if you're not 9 centimeters and getting it, probably not going to touch you. Well, they wouldn't give it to you also. But that early, that right timing, I think is valuable for this one.
It's key. And I think sometimes we give it and they're like, I didn't do anything. Like, I don't know why, but it literally, I feel the exact same. And I'm like, sometimes that's how you know you're in good active labor, right?
Yeah.
So,
and I think it's like you gave it a shot. And if you're wanting something else, then now you can maybe move on to a different tool because if it's not touching you now, it's not going to help if we do it again, that type of conversation.
Exactly.
All right, let's go to the next tool, which nitrous. I'm kind of curious how you are going to rank this one.
Yes.
So why don't you describe that one?
Yeah. So nitrous, it's basically nitrous oxide. So it's a mix of nitrous with oxygen and it's an inhalation tool. So a lot of you guys may have heard it as laughing gas. You know, when you go to the dentist and you're getting, I don't know, a tooth pulled or something, and they make you inhale the gas, it's the exact same thing. So in the hospital setting, we usually have them in every room attached to the wall, or we have portable machines that we can bring in if they don't have them in every room. And basically this one, you use it during the contraction. So once you start feeling the contraction starting, that's when you put the mask on, you start breathing in and out into the mask, and it kind of makes you feel like, I usually tell people, it makes you feel like you've had a couple of drinks. Makes you feel a little woozy, a little bit like it just kind of dims, you know, your surroundings a little bit and makes you feel a little bit like you're floating, and it's short-lived. So once you stop the contraction, that's when you take off the mask, you breathe in just regular oxygen, and you'll notice it'll start to dissipate really quickly. So once you start getting your other contraction in 2 minutes or however long it is, you actually need to breathe it in again. So every single contraction, you're breathing in the nitrous oxide to kind of give you a little bit of relief during the contraction. Some people love it. Some people hate it. I know I've been saying this for every tool, but this one in particular, I feel like if you are prone to feeling motion sick or nauseous, this one's not really a great one. I find it can make people sick, actually, if you have that motion sickness in you. Some people really don't like it. It just makes them feel sick, and they're like, you know what, that just made me want to vomit. So they stop it. Other people love it. And I will say I like it because it reminds people to breathe during the contraction. Because one of the hardest things, well, when you're in pain, you usually want to hold your breath. You know, even when you're working out and something gets hard, you have to you start to hold your breath, right? So it's the same thing with a contraction. And I find with the nitrous oxide, it almost just reminds people to do that big, deep inhalation and exhalation during the contraction, which I think is almost more valuable than the nitrous oxide itself. So I don't know. I'm torn with this one because I've seen it be very effective. And again, it's also usually only used kind of towards that transition phase or that end phase of labor, because this one isn't one that we can use for hours and hours and hours and hours. We only want to use it for a little bit, a short period of time. So if you're like 3 centimeters dilated and you're starting to feel pain and you want to try it, that's not the time. The time to try the nitrous oxide is when you're kind of in that transition phase around that 7 to 8 centimeter mark, or you're just starting to push. And sometimes it gives you that little bit of help that you need to get over that hump and to the next phase. So
that's perfect. I agree. I think it's one of those tools 50-50, like you like it or you think it did nothing for you. And so when I think about ranking it, I'd probably like stick it in the middle, only because some people, it's just not, you can't be sure that it will help you. But again, like worth
100%
worth trying. And then if you're like, nah, just toss the mask and you're done, you know?
Yes.
So.
Yes, I agree. I think I'd give it probably, like a 5 or a 6 because of that. But some people have tried it in their labors and they're like, oh my gosh, that's the best thing ever. I don't know how I could have done it without it. And other people are like, nope, that just made me throw up and I did not want it. So it's hard
Nobody
to
wants
say.
That. Yeah, I think it kind of goes back to like you said too, that it's making you breathe. Like how invaluable is that, right?
That part I really, really like.
Know that. And then the idea of control again, like with the TENS unit that you're controlling or the spiky comb, like having to think about it too, because there's a lot of thought of like, all right, I think it's coming. All right, I'm going to start breathing, and then you're done. And you have to be the one to do it. You can't have someone else keep like putting it on your face. And so it can help you think through things a little bit and maybe help with that like mental distraction piece again too. So that can be
such a good
nice
point.
for some. Yeah,
totally. That's such a good point that I think is often forgotten, is that sense of control that you are in charge of your pain management. You are in charge of if you want to be breathing it in or not, if you want to be squeezing harder on the birth combs or not. So you're so right. That's such a good point.
All right, let's get to the last one that everyone is familiar. Not the last one. I'm going to sneak one more in at the end, but the last big one that everyone's familiar with, which is the epidural.
The epidural. Yes. I mean, the epidural, it's, most widely used, the most common, and it's for a reason. It works really well. It's consistent pain relief for majority of people who use the epidural. It's great. I think it's a really good option, especially if it's timed accordingly, if it's timed at the right time, because you don't want to get the epidural too early, only because it kind of keeps you in bed. And I think there's still a million positions that I will put you in the bed with the epidural, but you can't be up and walking the halls with an epidural unless you have a walking epidural, if that's available to you. But I haven't worked in a facility that has walking epidurals available, but they work fantastic. They basically numb you from kind of your belly button down to your toes. And a good working epidural is an epidural that you're still able to feel touch and pressure, but you're not feeling that sharp pain sensation. So if I was to come to you with a needle, you wouldn't feel the sharpness of the needle in your leg, but you would feel the pressure that, oh, there's something there. Someone is touching me there. So a lot of people feel like if they get an epidural, they're going to be completely numb and not be able to move. That's not necessarily the case. A good working epidural, you'll still be able to move your legs. Sometimes, depending on the dosage or your anatomy, it can be really heavy and it can, prevent you from being able to move your legs a ton. But this is when we can, adjust the dosage that we're giving you of the medication. The epidural is also, it's a continuous infusion. So it's constantly giving you medication until the baby is born. And then after baby is born, that's when we shut it off. So I think a lot of people don't know that as well, that it's something that we hook up to like an IV pump and it's constantly going into your epidural space to keep your pain well managed, which is great because it can last for a long time, but you can still feel pressure. And I personally think that's a great thing because if you can feel the pressure of your baby coming down and lower into your birth canal, then you can push more effectively. So I like that.
Yeah, I think it's really important to clarify that pain pressure combo. And one of my favorite CRNAs always did a really good job about doing that. And he would say, hey, like, my goal is not to take you from 10 out of 10 to 0 out of 10. My goal is to get you to like a 3 out of 10. And why I say that is because that 3 is pressure. Like if your expectation is I want to feel nothing, we need to fix that expectation because this epidural I'm about to give you is not going to do that. Or that's not, my goal. Obviously you said sometimes they get heavy, but I like that he said that and like, let's reorient it because, then they leave the room and you're there with them as the nurse and they're like, I still feel something. And then you can kind of do the detective work of like, that's normal. Like, explain it to me, describe it to me. Is it painful? Is it pressure? And kind of help them analyze like, actually, this is working. All right. I understand what this new like equilibrium is, I guess, of what I'm going to feel.
Yep, exactly. And sometimes the pressure can honestly be painful, especially towards the end for some people. And, some people can cope with the pressure sensation better than others. But sometimes when it gets towards the end and you're getting closer to pushing, that's when you might want to reintroduce some of those techniques that you used earlier on, like the comb, like the spiky ball, like the TENS unit. Like some of those things might actually be helpful during that last phase, even with the epidural, to kind of distract your brain from that pressure sensation that you're feeling.
You used the word working, I'm air quoting right now, working epidural a few times when you were describing it. And I think that's important here too, because when I say, hey, rank a working epidural, what would you say? And then obviously knowing sometimes they work on one side and we're having issues, that's a whole other conversation. So an epidural that's working, how do you rank that one?
I would give that one a solid like 9 or 10 out of 10. Like it works great. It really does. Point. And again, if it's not working, if it's one-sided, there's things that we can do to change it. Unfortunately, that does happen. It's a low percentage of patients, but it does happen. But I would say it's fantastic. It works really well for pain. So definitely a 9.5 or 10 for me.
I would agree. I think almost maybe if there's anything negative, it's that if you're someone who it's so heavy that you're laying there thinking, you're not in pain, which is great, right? That's like the primary goal. But you're like, my legs, I can't feel them. I can't move them. Like typically some people are in love with having that much loss of sensation. So that could be a negative of one that's almost working too well. And it makes you too heavy.
Too numb. Yeah, exactly.
All right. The last one, which I'm familiar with, I will say like as a educator, academic, but we didn't do these. So I'm curious to see what you say, is called a Pudendal blocker, Pudendal block. There we go.
Yes.
I don't even know how to say it because we don't do them that often.
Yes.
What do you know about this one? Yeah. What would you share?
Yeah. So this is basically, I don't know. I'm not the one who would ever insert the Pudendal block. So I'm not an anesthesiologist or an OB who would be able to do it, but it basically numbs you only in the region that you're going to be giving birth. So kind of like your downstairs area. It's super effective. To be honest with you, only used it with one patient in my entire career. So it's very rarely used. But this patient she was just about to deliver. She was literally 10 centimeters. She was pushing and she was begging for pain relief, and we couldn't get her in the proper positioning to get an epidural. So that's not being said that you can't get an epidural at 10 centimeters. Some people can. It's just a matter of being able to safely position you for the epidural. But some people, when they get the contraction and they're that uncomfortable, they're moving their body so much that it wouldn't be safe to insert an epidural. And that's when the OB who was on was like, let's try a Pudendal block, because that can work really well. And yeah, so it's a very specific use. I would say not a ton of providers actually use them, but it is an option if you're kind of at that end stage and you really want something and the epidural isn't available to you or an option. Yeah, but I have seen it work. And for her in that particular situation, it worked really well. So
yeah, I'm like, I don't even know. I don't know that you even have to rank that one, since it's just not something we see that often.
Yeah.
I think, yeah, it's local anesthetic. That's nice for you guys to know. So it's just a shot of something in and then, needle out, and then it should just numb that area for pushing, but it's not doing anything else. There's no IV running. Like it's just similar to like if you get lidocaine after birth to numb you to get a tear repaired if you need it. It's just a shot to numb the area, and then it's a different shot, different area, but that type of idea.
That is a good thing about the Pudendal block, is if you do have any repairs, or if it's an emergency like forceps delivery or vacuum. I think it was so long ago that we did this, but I think it was a vacuum or a forceps. And that is really valuable because because when you're having like a vacuum or forceps, it can be more painful, or it can sometimes lead to some tearing. And if you need repairs afterwards, then you're numb. And that part is amazing. So
yeah, you're good to go.
Exactly.
Yeah. Mostly if you're someone who maybe can't have an epidural for certain reasons related to your anatomy, or maybe you're currently pregnant and it's blood work or something, just tuck that away. Like you could ask about that being a possibility if you thought it could be something you would need to.
Yeah. And bring it up at a prenatal appointment too, and just see if it's even something that's offered at your hospital too.
Yeah. I love that. Okay, Sydney, that was perfect. I think I thought, I don't know how long that would go, but man, we just crushed through those. I love that.
Yes. No, that was so fun. It's good to talk about all the different options, because labor, no matter what, you're going to have a certain amount of pain involved with delivering a baby. Unfortunately, it's par for the course. So it's good to know all the tools that are available and kind of what we've seen and what's worked and not worked, for sure.
Definitely. And I think a lot of people just think, oh, if I have pain, I'll get an epidural. And that's fine. And certainly you can, but there's a lot to try before or in the midst or whatever too. So that's why I love this combo is making sure people know that there's a lot of other stuff to try, particularly if they want to keep going before they get the epidural. What could you maybe utilize? So super valuable.
Yep.
All right. I'm going to ask you to pivot to something that that is part of your life or has been, and that you could kind of speak to in a way that I could not. So I'll mostly just let you lead this. But Sydney has a history of eating disorder. And so I wanted her to share with us a little bit kind of about that and how that could translate if you're similar into kind of getting pregnant and that adjustment for your body. So I'll just leave that and you can kind of share what you want on the topic.
Yes. Thank you so much for bringing that up. So I have successfully recovered from an eating disorder. It was mainly when I was in high school, so it's been many years now, but it was a severe eating disorder. I am lucky to be here today, but I'm happy to be fully recovered, but not without the help of my family, my friends, and an amazing medical team. I seriously would not have been able to do it without them. And that's kind of the biggest thing I want to mention here is that help and support and resources are available and they're necessary. You can't do this alone. So I haven't conceived a baby yet. I haven't been pregnant. Hopefully in the future with my husband, we just got married. So hopefully in the next few years, I'll be lucky enough to have a baby of my own. But leaning into that side of my life now, I'm actually preparing for that now. So I'm talking to my therapist. I'm making sure that my food and my relationship with food is at a good spot, because I know that entering into pregnancy and postpartum can be a really challenging time for people who have experienced an eating disorder and even people who haven't, right? It's a really challenging time. You're going through such a rapid change in your body and with your hormones, your emotions, literally everything. It's all out of whack and it can be so so overwhelming. So I think that especially people who have a history with maybe, you know, an eating disorder or even just body dysmorphia or a tricky relationship with food, I think it's really important to talk to your family doctor, talk to your obstetrician, talk to everyone in your life that has cared for you and just be like, hey, I want to make sure I'm at a good place so that when I get pregnant or when I have a baby, this doesn't become an issue and I don't necessarily go into relapse of any kind. And they'll be able to give you tools that you can use or support systems that you can have in place. Something that I found has been extremely helpful for me in my recovery has been making sure I'm following accounts online that are focused on body positivity and not necessarily weight loss or weight restrictions, and just embracing the changes that come with being a woman and having a woman's body, and whether that's related to pregnancy or not. But there's so many amazing creators out there who just share so much positivity, and they don't necessarily focus on, you know, weight restriction or making sure you're not eating so many calories in a day or you're restricting your calorie intake during pregnancy or anything like that. And I think that's super important because it's a dangerous slope that you can go down on social media. And I think it's really important to kind of surround yourself with people who are going to support you and lift you up through that time. That can be online and in person. So yeah, if anyone is struggling with that right now, just know you're not alone. This is something that so many people experience, and myself included. And I always tell people, like, being on the other side of it is so worth it. It is so much better than being caught in that day-to-day struggle of, you know, not having any energy because you're not fueling your body enough. And when that comes to growing a baby or sustaining, you know, breastfeeding and postpartum and all of that, you need to be fueling your body, right? We need to be taking care of ourselves and giving ourselves grace, because it's a lot. It's a lot.
Yeah. Thank you for sharing all of that. I think it can be a topic that can feel taboo. And then if you combine it with like the OB world, where there's this idea of we need to be incredibly grateful for the privilege of growing a baby and raising a baby. Yep. But then if someone were to struggle with this part, I could see that there could be people who are like, get over it. You know, this idea of you're raising a baby, like that should just not be part of, you know, your thought process right now. So my brain was kind of thinking through that, of specifically combining disordered eating or image issues with OB, and how there's another facet of like what you should be grateful for or how you should feel versus how you do feel. And that you have to wrestle with the differences of what people think versus what is true of what's going on in your head.
100%. And I think overall, everyone deserves compassionate care, no matter what it is that you're struggling with. You should feel like you're able to talk to your provider about anything, and that they're able to listen to you and validate you. And you can have like two things can exist at once. You can be struggling with the fact that you're gaining weight, or you're struggling with food intake or body image or anything like that. But you can also be super grateful for the privilege to grow a baby. Like, those two things can exist at the same time. And I think therapists and dietitians and all those people that you can have on your side, that's what you need to be able to navigate these feelings and be able to do it safely, for sure.
Can I ask you, because what I hear in that also is this idea of like communicating what's going on. So even pre-baby, like where you are right now, communicating that. Obviously, this isn't something you would want to hide from an OB/GYN when you start prenatal appointments. Do you know, like, would nutrition step in and be involved, or would it more just be an awareness? Depends on the person. Like if someone were to share this and make sure that their team knew about it, kind of like a what would come next for someone who's pregnant or postpartum?
Yeah. So from what I understand from like what I've gone through myself, it's very dependent on your situation. So if you're needing support in place for, let's say you do need a little bit more calories in your diet, or you do need some help with making sure that you're maintaining a certain weight, for example, or you're struggling to get a proper food intake, that's kind of when dietitian or nutrition would come in to kind of help guide you and maybe make sure that like they would sometimes list out like, okay, what have you eaten today? Let's go through it and make sure you're meeting all of the spots that we need you to meet during pregnancy. And honestly, that sometimes can be helpful for people who haven't even, gone through an eating disorder. I'm lucky enough to have had a lot of help with dietitians and stuff in the past. So I have a great foundation of that, but it is something that I still find helpful today to make sure that, you know, even when I go to want to conceive or I am pregnant, that you're just touching base with someone and being like, hey, Kate, this is what I'm eating. Is there any gaps or is there anything that I should be focusing on a little bit more or less? And when I'm saying that, I'm not saying a dietitian will be like, okay, you need to eat this, this, and this, and this. Like, they still leave room for obviously having like a piece of chocolate cake that you've been craving, you know, like it's very flexible. It's making sure you're able to have a good relationship with foods and not having like good and bad foods, if that makes sense. But yeah, I think it is something that can be integrated pre-conception, to be honest with you, and then during pregnancy as well, but dependent on your particular clinical situation and what feels right for you. If you have access to it, I think it would be an amazing resource.
It makes me think of mental health disorders like a postpartum anxiety or depression, and prenatal as well, because those are perinatal, but just this idea of like, speaking up doesn't indicate that you're going to become a burden or that you have to have 7 doctors providing for you all of a sudden, but simply making your team aware so that even when you're feeling so well and so healthy and so good in all the ways, making sure that that's part of, you know, your history and that people are aware, so that if something becomes a struggle, your care team is like, oh, we know this might happen. Yeah, like let's talk about next steps. So not hiding something like that for fear of being like labeled or burdensome or what could come next, because that awareness is valuable for the team as they care for you.
100%. It's so important to be honest with your care team, because that's how we can care for you effectively, right? And how we can put plans in place in case something does happen, or in case you start to go down a slope that you don't necessarily want to be in, then we can jump in and you know, have that early intervention, which I think is so key. So definitely, like you said, talk to your providers, be honest. And it's something as simple as saying like, even if it was 10 years ago, you know, say I have a history of, you know, being sensitive to my body weight and stuff like that. And then that way, even when you're getting your prenatal appointments and you're getting weighed, they actually don't even need to tell you your weight, or you can just refuse them altogether. Like, there's little things that we can do during your care to make it feel a little bit more personalized and a little bit safer for you.
So good. Thank you again for sharing all of that. It's an important conversation, especially for those who need it. You kind of said like some of this can apply to anyone as their body's changing, which is true. But then certainly when we add in this history, just so important. Why don't you, I know you kind of briefly mentioned it, remind everyone where they can find you on the different platforms, your website.
Yes. So you guys can find me on TikTok, Instagram, Facebook, YouTube at nurse_Sydney. And I do have a website. It's just www.nursesydney.com. So you can find me there. I have all kinds of resources too linked in my website for eating disorder recovery as well. In case anyone needs a little bit more information or you need some help, I always have it in my website as well.
Okay, perfect. We'll put all of that stuff in the show notes. Last question I love asking everyone before they go is, what's something in your life right now that is bringing you a ton of joy?
Oh
Big,
my gosh.
Small, anything.
The weather in LA. I am a Canadian girl and I just cannot get over the sunshine. It is so good. I love it so much.
It's funny. My sister, we grew up in the Pacific Northwest, and then she's moved around a few times, has now landed in LA. And we both were like, are you going to be okay? Like, it's sun year round, you know, it's pretty much nice every single day. And she has texted a few times and she's like, I don't know if I've gotten old or what, but man, I love that the sun shines every day. I am in. Yeah, she was here for it too. So
I was in the morning just sitting in the sun. Like, it's just the best thing ever.
I get it. I mean, I live in Colorado, but we get like 320 days of sun or something ridiculous a year. It's cold. Like, it's cold right now.
But it is sun.
There's something about that sun on your face.
Oh, it makes a difference.
I mean, for you, plus the heat that just changes everything.
It's amazing. I'm loving it. I'm not sick of it yet. I don't know if I ever will be, but
well, you could always jump on a plane and go to some snow if you're missing it, you know?
Exactly.
All right, Sydney, thank you so much. This was great. Thank you for the two like kind of separate topics. That was perfect. I was hoping we could do both. So I'm glad that we could.
Me too. Thank you so much for having me. I really appreciate it.
Thank you so much for listening to the Lo and Behold podcast. I hope there was something for you in today's episode that made you think, made you laugh, or made you feel seen. For show notes and links to the resources, freebies, or discount codes mentioned in this episode, please head over to loandbeholdpodcast.com. If you aren't following along yet, make sure to tap subscribe or follow in your podcast app so we can keep hanging out together. And if you haven't heard it yet today, you're doing a really good job. A little reminder for you before you go. Opinions shared by guests of this show are their own and do not always reflect those of myself and the Labor Mama platform. Additionally, the information you hear on this podcast or that you receive via any linked resources should not be considered medical advice. Please see our full disclaimer at the link in your show notes.